Okay, so you have seen anterior triangle. Okay, so we will discuss the theory portion first. Again, see the different boundaries and structures. Okay. So anterior triangle is a triangular area of the neck, and this is the boundary of the whole of the triangle. Okay, it has the following boundaries. Anteriorly there is anterior median line of the neck extending from the symphysis menti to the suprasternal notch here in the midline. Okay. Posteriorly, anterior border of the sternocleidomastoid muscle. Base, it is directed upward and formed by the base or lower border of the mandible. Here is the base of the triangle. Next is the line extending from angle of the mandible to the mastoid process. These two are together forming the base of the triangle. So apex is directed downward, base is directed above. Apex is directed downward, formed by the meeting point of anterior border of sternocleidomastoid muscle and anterior median line. And roof is formed by the skin, superficial fossa with platysma and investing layer of the deep cervical fossa. Okay, so these are forming the roof. See here the boundaries. So anterior boundary is formed by this anterior midline of the neck from symphysis menti to the suprasternal notch. Posterior boundary is formed by anterior border of sternocleidomastoid. Superior boundary or base is formed by the base of the mandible and line extending from angle of the mandible up to the mastoid process. Apex is formed by joining of the anterior and posterior boundaries here near the suprasternal notch. Next, so this is whole boundary of whole of the triangle, and it again consists of 3.5 triangles. Okay, half triangle is of submental triangle. Half is located on the right, half is located on the left. So this just below this symphysis menti, this is submental triangle. Rest are the complete triangle. This one is the Digastric triangle. Here is Carotid triangle, and here is the Muscular triangle. Okay. So see the boundaries of this triangle. Submental triangle, its apex is directed above near the symphysis menti, and base is formed by the body of the hyoid bone, and on the two sides it is bounded by the anterior belly of the digastric muscle. Next is we go to the digastric triangle. Here antero-inferiorly bounded by the anterior belly of digastric, posterior-inferiorly bounded by the posterior belly of digastric and the stylohyoid muscle. And base of the triangle is formed by the base of the mandible and line extending from angle of the mandible to the mastoid process. Okay, so this is digastric triangle. Next we are going to the carotid triangle. Carotid triangle, apex is directed towards the hyoid bone where the two bellies of digastric muscles are joining, forming the tendinous insertion of these two bellies over the hyoid. Here is the apex. Base is formed by the anterior border of the sternocleidomastoid muscle. It has antero-superior boundary. Antero-superior boundary is formed by posterior belly of digastric, and antero-inferior boundary is formed by the superior belly of the omohyoid. So this is carotid triangle, and here it just lateral to the midline of the neck. Here is the muscular triangle. Okay, muscular triangle, its boundary is anterior boundary by the anterior midline of the neck, posterior superiorly by the superior belly of omohyoid, and posterior inferiorly by the anterior border of the sternocleidomastoid. Okay, so now we will discuss the structures present in the anterior midline of the neck, and then different triangles and their contents. Okay. The anterior triangle comes in your theory. This schematic diagram you must practice. Okay. You will be asked to write down the boundaries and content of different triangles. Carotid triangle is very frequently given, or sometimes all of the triangles comes together in your theory. Okay. Okay, so anterior midline of the neck, anterior median region of the neck is about 2 to 3 centimeter wide vertical area extending from symphysis menti to the suprasternal notch. And the structure present in the anterior median region of neck are the skin, superficial fascia. Superficial fascia contains these four structure A, B, C and D. It contains the fibers of the platysma, and in some individuals, some fibers of platysma may decussate for 1 to 2 centimeter below the chin. Anterior jugular vein, it begins in the submental region. It descends about 1 centimeter lateral to the median region, about 2 to 3 centimeter above the sternum. It pierces the investing layer of deep cervical fossa and passes laterally deep to the sternocleidomastoid muscle. Okay, we have in the dissected body anterior jugular vein. Okay. Next is submental lymph nodes. They lie just below the symphysis menti. Okay, these we generally remove during dissecting. And transverse cutaneous nerve of neck. This traverses across the middle of the neck. Okay, traverses across the sternocleidomastoid. Next, deep fossa or infesting layer. In the upper part, it splits and encloses the submandibular gland, and in the lower part, it splits to enclose the suprasternal space. Okay, suprasternal space or space of burn. So, this is the lying in the superficial fossa and the deep fossa. Deep structures above the hyoid bone are the mylohyoid muscle and its median raphe. It lies over here, okay, in the floor of the mouth. Its mylohyoid muscle is forming the oral diaphragm. Two muscles of the two sides join in the midline in a single raphe. Okay, it is forming the oral diaphragm. Next is anterior belly of digastric, superficial part of the submandibular gland. These are lying in the deep structure above the hyoid bone. Next is mylohyoid nerve and vessels, submental branch of the facial artery. All these are content of mainly digastric and submental triangle. Next is deep structure below the hyoid bone. Here lies the pretracheal fossa, forms the false capsule of the thyroid gland and ligament of Berry. Infrahyoid muscles. These are the strap muscles of the neck. Sternohyoid, sternothyroid, thyrohyoid, omohyoid. Okay, four muscles are there. Thyrohyoid membrane is pierced by internal laryngeal nerve and superior laryngeal vessels. There are thyroid cartilage, cricothyroid membrane, cricoid cartilage, cricothyroid muscle, thyroid gland and trachea. Okay, understood? See here, so anterior midline structures, symphysis menti, mylohyoid muscle, these are the anterior belly of digastric, hyoid bone, thyrohyoid membrane, thyroid cartilage, cricoid cartilage, trachea starts here, isthmus of the thyroid gland, this is butterfly shaped thyroid gland, these are the anterior jugular veins, they are joined by the jugular venous arch, and this is suprasternal notch, and above it this space is known as suprasternal space of Burns. Okay, jugular venous arch is content of this suprasternal space. During tracheostomy, you have to incise over here, and you have to be careful to preserve these structures. You don't injure this isthmus of thyroid or this jugular venous arch. If injury occurs here, there will be heavy bleeding. Okay, so in jugular venous arch. So common anterior midline swelling includes enlarged submental lymph nodes. Okay, this will be hard. Then thyroglossal cyst. You have seen in embryology thyroglossal cyst. And goiter. Goiter will be enlargement of the thyroid gland. So these are the main regions for common midline swelling. Okay, you will get all these very common things you will get in your patients. Next is tracheostomy. It is a surgical procedure to create an opening in the neck and that allows direct entry of air into the trachea. Okay, so you have to palpate the trachea in the midline below the cricoid cartilage, and above the isthmus incision is given, or below the isthmus of the thyroid gland incision is given. Structure at the level of lower border of C6 vertebra or carotid tubercle. This is asked in your viva table, okay? Very important. Like the L1 level for abdomen, T4 level for thorax. Here this level is important. C6, lower border of C6 vertebral level. What happens at this level is important. And here lies carotid tubercle, okay? Cricoid cartilage ends here, lower border of cricoid cartilage. Junction of larynx and trachea is present at this level. Junction of pharynx and esophagus is also lying at this level. And site for palpation of common carotid artery. Okay, here you can palpate it. Thyroidea ema artery, it is an occasional branch of brachiocephalic artery or arch of aorta. It ascends in front of the trachea to supply the isthmus of the thyroid gland. If it is present, it will be present in the midline of the neck. Median thyroid ligament is the midline thickening of the thyrohyoid membrane. The thyroid membrane you have seen in previous picture, and hyoid bone lies at the level of C3 vertebra, and subhyoid bursa separates the thyrohyoid membrane from the hyoid bone, and upper border of the cricoid cartilage is lies here. Next is subdivisions. Subdivision of the anterior triangle. It consists of 3.5 triangles. So the anterior triangle of neck is subdivided by these two structures, anterior belly of digastric and superior belly of omohyoid, and they subdivide the anterior triangle in these 4 triangles, 3.5 mainly. Submental triangle, half on each side, digastric triangle, carotid triangle, and muscular triangle. See here, the color coding has been done. Here is the submental triangle. The green colored one is the digastric triangle. This pink one is the carotid triangle, and violet one is the muscular triangle. Okay, separated by these two bellies of digastric, anterior posterior belly of digastric and superior belly of omohyoid. Inferior belly of omohyoid lies in the posterior triangle, that you will see during posterior triangle dissection. Okay. This schematic diagram you practice. So first we are going to the submental triangle. Submental triangle is the median triangle of neck that lies below the chin and above the hyoid bone, and its each half part is contributed by each of the anterior triangle. These are the boundaries. Apex is directed above, lower border of symphysis menti or chin, base is by the body of hyoid bone, on each side anterior bellies of digastric muscles. Okay, you remember those picture? And floor is formed by the mylohyoid muscle and the median raphe extending from symphysis menti to the body of the hyoid bone. And roof is formed by investing layer of deep cervical fossa. Contents are the submental lymph nodes, submental veins, they join to form the anterior jugular veins. Okay. See here the contents. This is submental triangle. Apex is directed towards the chin or symphysis menti. Base is formed by body of the hyoid bone. On the two sides, two anterior belly of the digastric muscles. And floor is formed by the mylohyoid muscle and median raphe. And see, these are the contents. Submental group of lymph nodes, and these are the submental veins joined to form the anterior jugular vein, and these two veins will be connected by the jugular venous arch. Okay. So anterior triangle, submental triangle, and its contents are here. So if it comes as short note, you can practice a schematic diagram like this. Okay. So it is contributed by both anterior triangles of neck, and boundaries apex symphysis menti, base body of hyoid bone, on each side anterior bellies of digastric, floor is mylohyoid, roof is investing layer of deep cervical fossa, deep fossa of the neck. Contents are submental lymph nodes, submental veins joined to form anterior jugular veins. Next we are going to next triangle, Digastric triangle. It is also called Submandibular triangle as it is located below the base of the mandible. Here lies the submandibular gland, salivary gland. Boundaries are anterior-inferiorly by anterior belly of digastric, posterior-inferiorly by posterior belly of digastric and stylohyoid muscle. And base is lying above superior, formed by the base of mandible and line joining the angle of mandible and mastoid process of temporal. Apex is formed by intermediate tendon of the digastric muscle and floor is formed anterior to posterior by the mylohyoid, hyoglossus and middle constrictor of the pharynx. Roof is formed by the superficial part of submandibular glands enclosed within the investing layer of deep cervical fascia, ascending branch of transverse cervical nerve, cervical branch of facial nerve and platysma. All these structures are forming the roof. Next we go to the contents. Contents are stylomandibular ligament divides the triangle into anterior and posterior part. So contents of the anterior part of digastric triangle are facial vein, superficial part of submandibular gland, facial artery, submandibular lymph nodes, submental artery, mylohyoid nerve and vessels, hypoglossal nerve. Okay. Contents of the posterior part of digastric triangle are the lower part of parotid glands, external carotid artery and deep structures. Deep structures are styloglossus and stylopharyngeal muscle and glossopharyngeal nerve and styloid process. These are the deep structures. And deepest structure is carotid sheath and its contents. Carotid sheath contains the common carotid artery, external internal carotid artery, internal jugular vein and the vagus nerve. Okay, in between and posteriorly. See here, so this part is the digastric triangle. See here, anterior-inferiorly by anterior belly of digastric, posterior-inferiorly by posterior belly of digastric and stylohyoid. And base is formed by the base of the mandible and line joining the angle of the mandible and mastoid process of temporal bone. And floor is formed by these three muscles, mylohyoid, hyoglossus and superior constrictor muscle of the pharynx. All these are forming the floor. Okay, and contents we will see. So this schematic diagram you can practice. And another ligament have been shown here, stylohyoid ligament connecting the styloid process of temporal bone and hyoid bone. Okay. Here in this diagram you can see the contents. This is facial vein. This artery is the facial artery, tortuosity. From the tortuosity you will identify it, facial artery, very commonly given in your OSPI. These contents are important for your OSPI questions, okay? All those muscles, larger muscles and the contents. This is submandibular gland, okay? Here is submental artery, mylohyoid nerve and vessels, and this one is hypoglossal nerve, okay? And this is common carotid artery dividing into internal carotid, external carotid. You see, remember the artery which is giving branches is the external carotid, okay? Internal carotid does not give any branch in the neck. And the vein is the internal jugular vein, and in between the artery and vein at a deeper plane lie the vagus nerve, okay? And see, this is anterior belly of digastric, posterior belly of digastric, and here you can see styloglossus, stylopharyngeus, glossopharyngeal nerves, and here you schematic presentation of submandibular lymph nodes. Okay, so all these are content of the digastric triangle. Okay, understood? So anterior-inferior, so digastric triangle or submandibular triangle boundaries are anterior-inferiorly by anterior belly of digastric, posterior-inferiorly by posterior belly of digastric and stylohyoid, base by the base of the mandible and line joining angle of the mandible and mastoid process. Apex intermediate tendon of the digastric muscle, floor is formed by mylohyoid, hyoglossal, middle constrictor of the pharynx. Okay, and these are the contents. Anterior part contain the facial artery and vein, superficial part of submandibular gland, submandibular lymph nodes, submental artery, mylohyoid nerve and vessels, hypoglossal nerve. And posterior part contains the lower part of parotid gland, external carotid artery, styloglossus, stylopharyngeus, glossopharyngeal nerve, styloid process, carotid sheath and its content. So all these structures you have seen in the previous picture. Okay, so we have completed two triangle. Next we are going to carotid triangle. Very important. Okay, important for your theory, and also the structures can be given in your OSB. So carotid triangle contains part of all the three carotid arteries, common, external, internal carotid. These are the boundaries. See, this is the carotid triangle. Anterior-superiorly bounded by posterior belly of digastric and stylohyoid muscle. Anterior-inferiorly by the superior belly of homohyoid, and posteriorly by the anterior border of the sternocleidomastoid. So these are the structures forming the boundary of carotid triangle. Next is the floor. Floor is formed by four muscles: thyrohyoid, hyoglossus, inferior constrictor, middle constrictor. See, this one is middle constrictor. Here is the inferior constrictor, and thyrohyoid, hyoglossus have been removed. I will show in another picture. And roof is formed by investing layer of the deep cervical fossa. See here, the floor muscle have been shown. Middle constrictor, inferior constrictor, thyrohyoid, and here is the hyoglossus. Okay, hyoglossus also forming floor of the digastric triangle. Okay, so these are the four muscles forming the floor of carotid triangle. So boundaries have been shown: posterior belly of digastric, superior belly of the homohyoid, and anterior border of the sternocleidomastoid here. And floor muscles: hyoglossus, thyrohyoid, middle and middle constrictor and inferior constrictor muscles. So boundaries: carotid triangle, anterior-superiorly posterior belly of digastric and stylohyoid, anterior-inferiorly superior belly of homohyoid, posterior boundary anterior border of sternocleidomastoid. Floor is by the thyrohyoid, hyoglossus, inferior constrictor, middle constrictor, and roof is formed by investing layer of deep cervical fossa. Contents are carotid arteries, carotid sinus and carotid body. Carotid sinus is a swelling near the where the carotid common carotid artery bifurcates, and there one baroreceptor is present, oval shaped, that is known as carotid body. Internal jugular vein, common facial vein, pharyngeal vein, lingual vein, 9, 10, 11, 12, last 4 cranial nerves, superior laryngeal artery, and superior laryngeal nerve, which divides into internal and external laryngeal nerves, descendants hypoglossi, which is part of the Ansa cervicalis, sympathetic chain, carotid sheath, and deep cervical node. Okay, sympathetic chain lies deep to the carotid sheath, and Ansa cervicalis or descendants hypoglossi lies on the anterior layer of the carotid. So contents: carotid arteries, common, external, internal carotid, carotid sinus and carotid body. Internal jugular vein and its three tributaries: common facial vein, pharyngeal vein, lingual vein. Nerves are last three cranial nerves: vagus, glossopharyngeal, spinal accessory, and hypoglossal nerve. Last four cranial nerves: superior laryngeal branch of vagus with its internal and external laryngeal branches, descendants hypoglossi, sympathetic chain, carotid sheath, and deep cervical nodes along the internal jugular vein, that jugulodigastric and jugulo-omohyoid nodes. All those are contents of the carotid triangle. Okay. See here. This one is the, see, this is the boundary. This dotted line is showing the boundary of the carotid triangle. And see here the contents: common carotid artery, external carotid, internal carotid. Okay, and here this part is the carotid sinus, here lies the carotid body. And from the external carotid, see the branches: superior thyroid artery, this one is lingual artery, facial artery, here is the occipital artery, and ascending pharyngeal artery. These are included in the carotid triangle. Rest of the branch of external carotid, see this is posterior auricular, and two terminal branches are superficial temporal and maxillary. Okay, and this is internal carotid artery. And this is internal jugular vein. In between the artery and vein lies, this one is the vagus nerve. Okay, 10th cranial nerve. And see here, here is the 9th cranial nerve or glossopharyngeal. This was content of the digastric triangle. And see here, from the vagus nerve, this branch is arranging. This branch is the superior laryngeal nerve. Superior laryngeal nerve is dividing into internal laryngeal and external laryngeal nerve. Okay, and external laryngeal nerve lies along with the superior thyroid artery. So these are the content, and this is Ansa Cervicalis. This is descendants hypoglossi, and this is descendants cervicalis. This contains C1 root and C2, C3 joined to form the descendants cervicalis. Okay, these are forming a loop-like structure that is known as Ansa Cervicalis. Okay, this is very fine structure, generally torn during the dissections, and these three, common carotid, vagus, and internal jugular, these are component of the carotid sheath, and deep to the carotid sheath, posterior to the carotid sheath, lies the sympathetic chain. Okay, most deeper plane. And here is the accessory nerve, spinal accessory. Okay, 11th cranial nerve. Some part lies in the carotid triangle, some part in the digastric triangle. Okay, so 9th, 10th, 11th, and 12th. 12th is hypoglossal. So 4 cranial nerves you are getting here. Okay, understood? Next, so we have discussed the boundaries and content of carotid triangle. Next, muscular triangle. Muscular triangle boundary anteriorly by the anterior midline of the neck, extending from hyoid bone to the suprasternal notch. Posterior superiorly by the superior belly of omohyoid. Posterior inferiorly by the anterior border of the sternocleidomastoid. And floor is formed by the pretracheal fossa, thyroid and cricoid cartilages, and trachea. And roof is formed by the investing layer of the deep cervical fossa. So see here, deep fossa of the neck has 3 layers: investing layer, pretracheal layer, and prevertebral. Here 2 fossas are forming the boundaries. One is forming the roof, deep cervical investing layer, and one is forming the floor, pretracheal fossa. Okay. Next, we are going to the content. Content are infrahyoid muscles, sternohyoid, sternothyroid, thyrohyoid, and omohyoid. Omohyoid from the posterior superior, forming the posterior superior boundary. And some authors consider the infrahyoid muscles as the floor of the muscular triangle. Mainly these are considered contents, infrahyoid muscles. So muscles of the anterior triangle are grouped as these two groups. These are very frequently asked in your viva. Suprahyoid muscle, infrahyoid muscle, important for your OSP. One muscle you will be given to identify which muscle is this, it is included in which group, and write down names of other muscles of this group. Like this OSP questions come. Okay. Otherwise you will be asked origin, insertion, nerve supply, action, like this. Okay, and forming the boundary of different triangle. Okay, so suprahyoid muscles and infrahyoid muscles. Suprahyoid 4 pairs, infrahyoid 4 pairs. Infrahyoid muscles are known as strap muscles. Suprahyoid muscles are digastric, stylohyoid, mylohyoid, and geniohyoid. And infrahyoid muscles are sternohyoid, sternothyroid, thyrohyoid, omohyoid. Okay, understood? See here are the suprahyoid. This is hyoid bone. So above the hyoid will be suprahyoid muscles. Below the hyoid will be infrahyoid muscles. Suprahyoid muscles are the digastric, stylohyoid, mylohyoid, and geniohyoid. Okay, geniohyoid are in the deeper plane. And next, infrahyoid are sternohyoid, omohyoid. These are lying in the superficial plane. Omohyoid is lateral, sternohyoid is medial. And deep to this sternohyoid. Here sternohyoid and omohyoid has been cut in this side. Here we will get other two muscles. Sternothyroid up to the oblique line of the thyroid cartilage, and from here up to the hyoid, thyrohyoid. So sternohyoid, sternothyroid, thyrohyoid and omohyoid. Okay. All these four muscles are included in the infrahyoid group of strap muscles. The schematic diagram you can practice like this: omohyoid, sternohyoid, sternothyroid, thyrohyoid. Okay. You can read their origin, insertion, nerve supply, and actions. Okay. Mainly these strap muscles are getting a supply from Ansa cervicalis. Okay. And this thyrohyoid is getting its nerve supply from C1 fibers through the hypoglossal nerve. Okay, rest from the Ansa cervicalis. Main function is depresses the hyoid bone, all the muscles. Main function is depression of the hyoid bone, elevation of the larynx when the hyoid bone is fixed by the suprahyoid muscles. So infrahyoid muscles are ribbon-like, hence called strap muscles of the neck. They are arranged in two layers, superficial layer and deep layer. Superficial layer contains sternohyoid and omohyoid, and deep layer contains sternothyroid, thyrohyoid. And all the infrahyoid muscles are supplied by ventral primary rami of C1 to C3 spinal nerves. They are derived from the longitudinal muscle seat that extends vertically from symphysis menti to pubic symphysis, okay, during the development of the embryo. The intermittent part of this seat disappears, whereas remaining part forms strap muscles, including geniohyoid near the hyoid region, infrahyoid muscle, strap muscles, sternalis, muscle of thorax, and rectus abdominis and pyramidalis, muscles of the abdomen. All are lying near the midlines. Okay. Next we go to Ansa cervicalis. It comes in your short note. Ansa cervicalis. Okay. It is also called Ansa hypoglossal. It is a loop of nerve fibers embedded in the anterior wall of the carotid sheath. How it is formed? It is consists of two roots, superior root and inferior root. Superior root is known as descendants hypoglossal. See here, this one is superior root. It containing fibers from C1 which is coming along this hypoglossal nerve, and this C2 and C3 join to form the inferior root, also known as descendants cervicalis. So superior root or descendants hypoglossal, these are the fibers of C1 spinal nerve, and that traverse through the hypoglossal nerves, exit as the descending branch, and it descends over the internal and common carotid arteries. Next is inferior root or descendant cervicalis. It descends from the C2 and C3 spinal nerve, and it descends, winds around the internal jugular vein, and then forms a loop with the superior root in front of the common carotid artery at the level of carotid cricoid cartilage. Okay, and distribution: the superior root supplies to the superior belly of omohyoid. See here, superior root giving branch to superior belly of omohyoid. Okay. And Ansa cervicalis, this part is Ansa U-shaped loop. It is giving branch to sternohyoid, sternothyroid, and inferior belly of omohyoid. Okay, and inferior belly to the inferior root of inferior belly of the omohyoid. Okay, so C1 fibers are supplying to the superior. The C1 fibers, they are coming along with the hypoglossal nerve. They are also giving supply to the nerve to geniohyoid and nerve to thyrohyoid. Okay. So Ansa cervicalis, loop of nerve embedded in anterior wall of carotid sheath. Formation: superior root, descendants hypoglossal, formed by C1 fibers. Inferior root, descendants cervicalis, fibers from C2 and C3, and both roots join to form the loop. Distribution: superior root, superior belly of omohyoid, Ansa, sternohyoid, sternothyroid, inferior root of inferior belly of the omohyoid. Next we go to the detailed discussion of the carotid artery. So common carotid artery, it is the main artery of the head, neck and the brain. Beginning, the right common carotid arises from the brachiocephalic trunk behind the sternoclavicular joint. and the left common carotid arises from the arch of the aorta. Direct branch you have seen during thorax. So course, each common carotid artery runs upward and laterally from the sternoclavicular joint to the upper border of the thyroid cartilage. Okay, here it bifurcates at the upper border of thyroid cartilage. Termination, each common carotid divides into internal external carotid arteries at the level of upper border of lamina of thyroid cartilage, and it corresponds to the disc between the C3 and C4 vertebra. And branches are, common carotid does not give any branch in the neck. All the branches coming from external carotid. So carotid tubercle, it is a tubercle on the transverse process of C6 vertebra. Remember it. Common carotid artery can be compressed against this tubercle and it lies about 4 cm above the sternoclavicular joint. Okay. Carotid sinus and carotid body. Carotid sinus is fusiform dilatation at the bifurcation of common carotid artery, and it has baroreceptors. Innervation, it receives fibers from glossopharyngeal vagus and sympathetic nerves, and the baroreceptors of the carotid sinus regulates the blood pressure. Stimulation of carotid sinus as increased blood pressure produces a reflex fall of blood pressure and slowing of the high. Okay, it can sense the blood pressure. Okay, and accordingly it maintains the blood pressure by increasing or decreasing. Next is carotid body. It is a small oval neurovascular structure situated behind the bifurcation of common carotid artery. It is a reddish brown structure, has chemoreceptor supplied by glossopharyngeal vagus sympathetic nerves. Function, it gets stimulated by excess CO2 or reduced oxygen in the blood and produce rise in the BP, heart rate, respiratory rate and depth of respiration. Clinical integration is carotid sinus syndrome and potato tumor of the neck. Carotid sinus occurs in patients with hypersensitive carotid sinus. These patients undergo sudden attacks of syncope or fainting and slowing of the heartbeat on rotation of the head. Okay, whenever this is stimulated, there is fall in BP and there will be syncope or fainting of the patient. Okay, and potato tumor of the neck. It is produced by enlargement of the carotid body, and the tumor moves transversely. It is pulsating and produces attacks of fainting due to pressure on the carotid sinus. And do not tie the necktie highly as it may compress the carotid arteries supplying to the brain. Blood supply will be decreased to the brain. Next we go to the internal carotid artery. It runs upward, has a continuation of common carotid artery, posterolateral to external carotid, and it ascends upward in the carotid sheath up to the base of the skull, extends into the skull through the carotid canal. Okay, L-shaped canal is there. The internal carotid artery does not give any branch in the neck, and structure passing between the internal external carotid arteries in the upper part of neck are these structures. These are sometimes asked in your viva. Okay, what structure passes between external and internal carotid? Part of parotid gland, styloid process of temporal bone, styloglossa, stylopharyngeus muscle, glossopharyngeal nerve, pharyngeal branch of vagus. Okay. So next we are going to external carotid artery. It is the main artery supplying the structure of the neck and face, and beginning, these large arteries are important for your OSPE. You will be asked as a related question, its beginning, ending, branches like this. Okay. So beginning, external carotid very frequently given. It begins as terminal branch of common carotid at the level of upper border of thyroid cartilage opposite the intervertebral disc between C3 C4. Okay. Course, it runs upward and slightly backward and laterally. Termination terminates within the parotid gland by dividing into these two branches, maxillary and superficial temporal arteries at the level of the neck of the mandible. These are the branches. See here, these are the branches: superior thyroid, lingual, facial, ascending pharyngeal, occipital, posterior auricular, and two terminal branches, superficial temporal and maxillary. So external carotid artery gives 8 branches. Medial branches is ascending pharyngeal, this one, medial branch. three anterior branches. These three are anterior branch. Superior thyroid is the first branch. Then you will get lingual artery and then facial artery. Facial artery will be tortuous. Two posterior branch. These two are posterior branch, occipital and posterior auricular. And two terminal branches are the superficial temporal and maxillary. Okay. So external carotid beginning, terminal branch of common carotid begins at the level of upper border of thyroid cartilage. Termination by divides into maxillary and superficial temporal within the parotid gland at the level of neck of the mandible. Okay. And branches are these: ascending pharyngeal, superior thyroid, lingual, facial, occipital, posterior auricular, superficial temporal, maxillary. 8 branches. Okay, that's all. So we will go to the cadaver. We'll see all the boundaries of the triangle and its contents. Okay, understood? So you prepare external carotid, all the boundaries of the triangle, and carotid triangle and its content for your theory.